Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. We are still doing our course, basic emergency care course. This is based on WHO course. In this session, we are going to discuss difficulty in breathing. Now we are going to discuss elements of secondary survey. In the primary survey, we have discussed the ABCDE approach for life-threatening condition. Here, we would like to recognize sign of difficulty in breathing. We would like to list high-risk causes of difficulty in breathing, perform critical skills for high-risk causes of difficulty in breathing. For any acutely or critically ill patient, start with ABCD approach. Remember, always start with ABCD approach and treat life-threatening conditions. Then take sample history. Sample history is symptom and sign, allergy, medication list, past medical history, and last oral intake and events surrounding the condition. We'll go into details of this sample history now, and after that we will do secondary survey. The first element of sample history is sign and symptom. You need to ask, when did the symptoms start? Was the onset sudden, or was it a progressive illness? Do they come and go? How long do the symptoms last? Have there any change over the time? Any similar episode? How was it and how was it handled? Sudden onset of shortness of breath. Think about airway obstruction, like foreign body, swelling of the airway due to allergic reaction, trauma to the airway, lung, heart, or chest wall, and toxic inhalation. Also, cardiac condition can present suddenly, like arrhythmia, heart attack, and valvular problems. Rapid onset of breathing can happen with poisoning, with acidosis, as in diabetic ketoacidosis, and anxiety. Slower onset shortness of breath, it can happen with infections, presence of fluid in the lung, as in tuberculosis and heart failure, like pulmonary edema or pleural effusion, fluid around the heart, as in pericardial fluid in tuberculosis and kidney disease, lung cancer, it can present as progressive illness, diseases affecting muscle of the chest wall, and asthma and COPD. You need to ask whether there is anything that trigger the difficulty of breathing, what make it better, what make it worse. Allergic reaction can be triggered by certain exposure, and it can lead to airway narrowing, plus it can lead to anaphylaxis and swelling. Inhalation, like in fire and chemical inhalation, it leads to more airway swelling and edema. Exposure to chemical and pesticide, it can lead to pulmonary edema and muscle weakness. If patient get orthopnea, consider pulmonary edema. Patient with allergic reaction and anaphylaxis can present with swelling of the mouth, lips, tongue, upper throat, and it is accompanied by voice change. These patients can progress to complete airway obstruction quickly. You have to observe them and monitor them. Listen for abnormal breath sound. Wheezes, which is a high-pitched sound during exhalation, it indicates narrowing of the lower airway. It can happen in asthma, COPD, heart failure, and some allergic reaction. Stridor, which is a high-pitched squeaking sound during inhalation, it indicates upper airway narrowing or blockage. Gargling, which is low-pitched bubbling, it indicates mucus or fluid in the airway. Presence of pain can give clue about the cause of shortness of breath. Patient with pleuritic chest pain can have pneumonia or pulmonary embolism and infarction. Also, pleuritic pain can happen with rib fracture and chest wall muscle contusion. In addition, you can get squeezing pain in heart attack, and also pneumothorax can present with chest pain. Presence of fever can indicate or suggest infection. Cough can happen in different conditions. Cough with wheezes can be seen in asthma and COPD. Cough with fluid sound could be seen in pneumonia and pulmonary edema. Leg swelling can give a clue Presence of bilateral edema can be part of heart failure or renal failure or generalized edema. Swelling of one leg could be part of DVT that can lead to pulmonary embolism. Remember that pregnant lady can have both DVT and PE, and the pregnancy can exacerbate heart failure. The second component of sample history is to ask about allergy. Allergy can be triggered by anything, by medication, by insect bite, by plant, by food. Severe allergic reaction can cause airway swelling and difficulty in breathing. So you need to ask if there is specific allergy to specific medication or any substance, and recent insect bite. As we mentioned before, allergy can be the cause of the current illness, or presence of allergy can have impact or implication on the use of certain medications. In sample history, after we take the symptom and sign and we highlight the allergy, then we ask about medication. What are the current medication? Any new medication, any change in doses. New medication or change in dose can cause allergic reaction. Some of these can lead to difficulty in breathing. Accidental overdose can stop breathing, as in narcotic and benzodiazepine. Also, the use of certain medication can have implication about what we are going to prescribe for the current illness. The fourth component of sample history to ask about past medical history. Presence of certain illness can lead to acute exacerbation, like patient with asthma and COPD can present with acute exacerbation and difficulty in breathing. Those with coronary artery disease or kidney disease can present with pulmonary edema and difficulty in breathing. History of cancer and tuberculosis can lead to pericardial effusion, and this also can present with difficulty in breathing. In past medical history, for example, diabetes can present with acidotic breathing in diabetic ketoacidosis, or they can present with coma, and coma can lead to airway obstruction by the tongue. Those who smoke are at risk of asthma and COPD, and on the long term they can develop lung cancer or heart attack. Patients with HIV are more prone to infection. After we screen the patient for symptom and sign, we highlight the allergy, we list the medication, and we check past medical history. We want to know when was the last oral intake. Patient with full stomach, especially when they lose consciousness, are at risk of vomiting and aspiration. In addition, if you want to do intubation, you need to be very cautious. So last oral intake can have implication on the current situation and future management. Events surrounding the current illness, like someone who get difficulty in breathing while eating, you need to consider choking. Those who are exercising and then they develop chest pain, you consider heart attack. Those who are exposed to fire or burn, you need to consider inhalation injury. Consider drowning, inhalation of water. If a person is found in or near water, even a small amount of inhaled water can cause serious lung damage. You have to watch them carefully.